to be your nurse today. So what brought you in today?
Well, I haven't been feeling really good. My stomach's been hurting. I've been having a lot of diarrhea. I'm just tired all the time, just not feeling good.
Okay, I'm gonna go ahead and get some vitals, and I'm gonna assess you and ask you some questions. Is that okay?
I think she just ate something bad or maybe dehydrated a little bit.
Okay.
Just a little out of it.
Alright, we're gonna try to figure out what's going on. So I'm trying to get temperature. Alright.
Okay.
So it looks like you have a slight fever. It's about 100.1.
Okay.
So I'm just gonna continue my assessment.
Okay.
I'm gonna listen to your bowel sounds. Okay. I'm just gonna feel it. Is there any pain when I touch?
It hurts a little.
Okay. Alright, and do you have any abdominal pain usually throughout the day?
Yeah, like all the time, and I gotta run to the bathroom.
Is there anything that makes it worse?
Sometimes when I eat, like it gets worse.
Okay, and how often are you having diarrhea a day?
Like 3 or 4 times a day.
Okay. And I'm just gonna take a look in your mouth to make sure there's no ulcers or anything. Alright. Alright, so I'm gonna go ahead and get some fluids started, and lab will be with you shortly to get some labs drawn, okay?
Okay.
Hey, good evening.
Hi.
My name is Amanda. I'm going to be your doctor. And the nurse told me some of the assessment that she got that you're having some diarrhea and pain in your abdomen. So I'd like to order some tests and see if we can figure out exactly what's going on with you. We're going to get blood work, a stool sample, and a CT. And then I'm also going to send you for a colonoscopy. And then once we get all those results back, we should better know what's going on and come up with a treatment plan for you.
Okay, what's a colonoscopy?
That's actually a procedure that's gonna to look at your large intestine, and I'll be able to see if there's any like inflammation or what's going on the inside.
Okay.
Yeah.
Alright, sounds
Yeah.
good.
Okay. Well, they'll be in shortly to go ahead and start those tests.
Doc, do I need to be here for that?
No, you can step out, and they'll come take care of her.
I don't think I wanna see that side of my wife.
Yeah. So yeah, that's no
Like, look all
problem.
of me.
I do.
Yeah, and
The outside.
we have your number. We'll just call you if we need to.
Okay, thank
all
you.
right. Thank you. Bye.
Go down, go.
So the doctor has ordered some labs and some stool tests to rule out Crohn's. So if there are WBCs and platelets in the blood, it may be a sign of infection or inflammation in the body. And if indeed there's blood in the stool, that is potentially a sign of Crohn's as well as any other or another inflammatory process. So that being said, I do believe I see a little blood. Okay. This has always been complicated. Okay, our test is done, and now I actually have results for the doctor.
Knock knock. Hey Daniela, I'm Amanda, I'm the doctor. I got your results back, and So I'm just gonna go over the test and kind of explain, what they resulted.
Okay.
So for your blood work, your hematocrit and your hemoglobin was decreased, so it looks like you have, anemia. And your ESR was increased, and that's from all the inflammation in your bowels, because Crohn's disease essentially is inflammation of the intestinal tract. So I'm just gonna keep going with the blood work. Your white blood cells are increased because of infection. All the increased acid has started breaking down the tissue, and it's left you prone to infection. And it looks like you do have an infection, and we'll probably start you on some antibiotics for that. And also, the stool sample came back positive for blood, which is typically seen with Crohn's disease. And your electrolytes were definitely off balance, and your potassium, your sodium, your magnesium, and your calcium were all decreased, and that's because you can't keep any food down, and your body's not able
Yeah,
to.
it just runs right out of you.
Yeah, you can't
Yeah.
absorb the nutrients from the food, so that's another expected finding, but we can get all of that fixed up for you.
Okay.
Yeah, and their colonoscopy results also came back, and they showed a cluster of inflammatory cells called granulomas, which is a definite.
Is that cancer?
No,
Okay.
it's not cancer, but it is. It does confirm that you have Crohn's disease.
Okay.
So with that being said, Crohn's disease can be managed with different types of medications, but one of the major ways that you manage the disease is with lifestyle changes with your diet primarily. So we're going to send in a dietitian to talk to you about different ways to manage your disease, as well as physical therapy.
Okay.
So
What do you need physical therapy for?
physical therapy can.
Okay.
Oh, that's on the video.
Physical therapy is going to help you with different techniques to help you manage the disease process.
Okay.
So they should be in shortly.
Alright, make him cute.
Okay.
One.
Knock knock. Hi, Miss Chrysler. My name's Julia. I'm from Dietary. Just
Hi.
coming in to talk to you. I know you got a recent diagnosis of Crohn's disease, and so Dietary has a lot to go into that. And there's certain foods that are good for you to eat, or there's some that can that are not good for you to eat when you have a flare up. So it's good for us to make a little dietary plan, and so we'll just make a little meal plan for breakfast, lunch, and dinner.
Okay.
So I was just wondering, what are some foods that you like to eat, or what are some things that you have to have?
Like every day I have my coffee. Like I have like 2 cups every day. So I'm always tired, so I gotta have my caffeine. And I'm Mexican, so a lot of hot sauce, salsa, let those go. I have 2 kids, so I drink like a bottle of wine every night. I also like fish and eggs. I'm not too picky.
So just a few things about that. When you're having an exasperation, some of those foods are trigger foods. I know you like your coffee and the wine and the spicy foods, but those, it's better for you to cut back on those or try and cut those out just to help you. But I know you like fish and you like eggs, and those are good things for you to eat.
Okay.
So, you want to make up a plan for maybe breakfast? You want to eat eggs for breakfast?
Yeah, that sounds good.
Okay. Do you like to eat fish maybe for lunch or dinner?
Yeah, do you guys have like fish tacos?
Yeah, we can do fish tacos.
Okay.
All right. Do you like lean cuts of pork or white meat poultry? Any of that?
I like white meat chicken.
Okay. We'll put that down for dinner.
Okay. Can I have a salad with that?
Yeah, you can have a salad. Maybe put some cucumbers in there, but try and avoid broccoli or cauliflower, okay?
Okay.
And then if you want to have a banana, cantaloupe, those are good low fiber fruits for you. Maybe some oatmeal every now and then. And then try and have 4 to 6 small meals a day. Just instead of, big breakfast, lunch, and dinner, maybe do some littler ones and have some snacks in between.
Okay.
And when you're having these aspirations, it's also good to avoid milk and milk products.
Okay.
It's like ice cream, that sort of stuff, okay?
Can I finish my coffee though? It's almost gone anyways.
It's not the best idea, but I'm not going to restrict you.
Alright, I won't get another one, okay?
Okay, deal. Thank you.
You're on.
Hi, Miss Geisler. My name's Lacey. I'm going to be your physical therapist. How are you?
Great, how are you?
Good. I'm just going to talk to you about some lifestyle changes and kind of see what your activity level is. With your new diagnosis of Crohn's, that can help you reduce your flare-ups. Are you having any urinary or fecal incontinence?
No, I just have to go all the time, but
Okay, how active are you?
I'm kind of a slug,
Okay,
but I'm tired all the time.
okay. Well, if we increase your physical activity, that's going to help decrease the inflammation in your GI tract.
Mhm.
And if we can reduce that inflammation, then we can try to get you feeling better and it'll give you more energy.
Okay.
Also, with you having Crohn's disease, you're at a higher risk of osteoporosis. So if you increase your physical activity, that will decrease that risk.
Okay.
So like maybe some brisk walking or jogging. Do you like cardio or yoga?
I like the rollerblade.
Okay, well that's perfect.
Okay.
Yeah, so let's just make sure you do that 3 to 5 times a day, and that's going to help reduce those flare-ups.
Okay.
Okay?
Alright,
All right.
thank you.
Have a good day.